Hi everyone, this is my presentation on Doxirobe, or better known as Doxycycline. So this is just a picture of its expanded structure so you guys can understand what it looks like, what atoms it has within it, and its molar mass. So a brief history and fun facts. So doxycycline belongs to the group of medications known as tetracycline antibiotics. Doxycycline is derived from oxytetracycline, which was first manufactured in the 1950s. Antibiotics such as doxycycline will not work for colds, flus, or other viral infections. Using antibiotics when they are not needed can cause it to not work for future infections. And I have picked this drug without knowing what it was, and it turns out I've been taking doxycycline monohydrate since March for my acne. So I thought that was kind of funny. Disorder treated and uses. So doxycycline treats a variety of bacterial infections like pneumonia and other respiratory tract infections, certain infections of the skin or eye, infections of the lymphatic, intestinal, genital or urinary systems, and certain other infections that are spread by ticks, lice, mites, infected animals, or contaminated food or water. Doxycycline can treat acne or rosacea. It can prevent malaria and help people with anthrax. And it can be used for people who cannot be treated with penicillin to treat certain types of food poisoning. And so, mode of action, I did a lot of research on this, and so basically, I start out with explaining what translation is. So, there's the mRNA right here, and that encodes the way the amino acid assembles to form a protein, and it is sandwiched between two parts of the ribosome, the start codon, which is the 30S right here, and the binding site, which is the 50S, which is right here. So basically, the 30S subunit of the start codon starts the whole translation process, and then the large subunit joins, and then the tRNA molecule, which is about right here, attaches to amino acid, and then that amino acid goes to the A site, and then that moves to the P site where the peptide chain starts to form. And then the amino acid leaves the tRNA, and then it leaves the E site and for the bacteria to use. So that's basically how translation works and how a peptide chain becomes a thing to make a protein. So what doxycycline does, it stops protein synthesis by binding to the 30S bacterial ribosome subunit. So if it binds to the small ribosomal subunit, then it stops the whole translation process. So that prevents the tRNA from binding to the A site of the ribosome, which prevents the addition of amino acids to the growing peptide chain, so no proteins are being made, and without proteins, bacteria are unable to function. And so that makes sense because doxycycline works to treat infections by preventing the growth and spread of bacteria, and without proteins, bacteria can't function. And doxycycline is a bacteriostatic, which means it stops bacteria from reproducing, but it doesn't necessarily kill them. And it works to treat acne by killing bacteria that infects pores, and it decreases a number of natural oily substances that causes acne. And it works to treat rosacea by decreasing the inflammation that causes this condition. So some side effects, you can experience nausea, vomiting, diarrhea, loss of appetite, sore, irritated throat, swollen tongue, dry mouth, back pain, changes in color of skin, scars, nails, eyes, or mouth. So some precautions, you should avoid a lot of sun time and tanning beds when you're using this. Tell your doctor if you're allergic to doxycycline or any other tetracycline drug, and tell your doctor if you plan to be pregnant. Doxycycline can affect an unborn baby, and this medication passes into breast milk.